Okay, so now we're looking at the pelvic girdle. Okay, so the pelvic girdle is three collective areas here. We have the ilium, which is the large flat part at the top. And then down here, you can divide this actually into two. So the pubis is the side with the pointy end. The ischium is the rounded side. Okay. On top of the ilium here, you have the iliac crest. Okay. We have the anterior superior iliac spine, the posterior superior iliac spine, the posterior inferior iliac spine, and the anterior inferior iliac spine. The large hole here where the head of the femur is going to come in is the acetobulum. Okay, down here on the ischium, you have the ischial tuberosity, which is this kind of roughened region right here. We have the pubic rami, so right here as well as right here. The large holes, the obturator foramen. On the backs, or kind of on the side here really, you can see the greater sciatic notch right here, and the lesser sciatic notch right here. So the greater is this larger one, the lesser is right here underneath the ischial spine. So now we're looking at the femur. Okay, on the femur, starting here at the top, you have the head of the femur. The fova capitis is kind of this hole indention right here in the head. The neck, where the head starts to narrow out. Okay, then you have two trochanters. You have the greater trochanter up here on the top, and the lesser trochanter is this projection down here. Okay, the shaft of the femur. You also have the linea aspera, which if you find the lesser trochanter and go down into the shaft, it's kind of a raised line right here. So the head of the femur points medially. So on the bottom you have two condyles, a medial and a lateral condyle. These are separated by the intercondylar fossa. Intercondylar fossa. You also have a medial and lateral epicondyle, so condyles, epicondyles. You flip it over, you have the patellar surface. It's kind of the flattened part right here where your kneecap would sit. Okay, this is the fibula. Fibula is pretty simple. You've got the head up here. It's kind of got this U-shaped indention, so you can distinguish it there. You've got the shaft, where my hand is. And then at the bottom here, we've got the lateral malleolus, which is the pointed part right here. Okay, so this is the tibia. So this is the top part of the tibia where it would connect with the femur itself. Okay, so just like the femur, we've got the two condyles. You've got your medial and your lateral. Okay. Then we have our intercondylar eminence, which is this raised part right here. We have the tibial tuberosity right here, kind of in the front. It's a raised region, roughened region. This whole section here is the anterior border. And then at the bottom, you can see this one large projection here. That's the medial malleolus. Okay, so this is your foot. You've got two bones here in the back, the talus and calcaneus, heel bone, kind of ankle bone. You've got, so in the hand we had carpals. In the foot we have tarsals with the T. Followed by the long bones here are your metatarsals, and then the toes are still called phalanges Remember, you have a distal, medial, and proximal.